Hello everybody, welcome to this channel once again. I'm Dr. Mile and I'm a family physician. Thank you for tuning in. Please subscribe to this YouTube channel and click on the notification bell so that you'll be alerted when I drop new videos. Today I'm going to continue the discussion on how to enjoy a patient-doctor encounter from the patient's perspective. And the first point is to our women of reproductive age group who are still menstruating. Please keep a menstrual calendar. It's important that you remember your last normal menstrual period because it can determine the treatment plan that will be given to you. Pregnancy must be excluded irrespective of your complaints. It's going to determine what investigations you're going to do. It's also going to determine what type of drugs you're going to get if you were pregnant. So you see why it's important that you keep a menstrual calendar. Pregnancy symptoms, early pregnancy symptoms can mimic any form of febrile illness. So it's important that pregnancy is excluded so that you won't be given the wrong drugs. The first 8 weeks of pregnancy is very important, and any insult to the growing fetus at that point in time can cause some malformations. So it is important that pregnancy is excluded at every point. I'm emphasizing this because there have been people who have been exposed to drugs, investigation that they shouldn't be exposed to because the patient didn't remember their last menstrual period, or the doctor didn't keep in mind that such patients may be pregnant. Some people have even lost precious pregnancies as a result of this reason. The second point is that I found out that some patients get really irritated when doctors ask them questions that they perceive are irrelevant to their complaints. As doctors, we make diagnosis from our interview, from us interviewing you, from us doing a physical examination on you. Sometimes we request for investigations before we reach a conclusion, a diagnosis or an assessment. Some people get irritated when we begin to ask questions that they think are irrelevant to them. Please do not get irritated when your doctor is asking you some questions. The reason is because such questions that you perceive are irrelevant, are in fact helpful to reaching a conclusion or an assessment. There are some people who have presented in a clinic on account of some complaint, but because their doctors were meticulous, they were able to diagnose something that is even more dangerous, that can kill them faster. So there's no question that is irrelevant. Please just be patient and allow your doctor to do his or her job. The third point is about investigations, and there are two sides to this. There's some people who come to the clinic or present in the hospital with investigation results and they want to get treated. I've seen patients come to my clinic with investigations and they say, I did this test and I want to get treated. Please, it doesn't work that way. We're not trained that way. We're trained to ask you questions, to have a rapport with you, to interview you, to ask you questions, to examine you before we, if need be, request for labs and other form of investigations before we reach a diagnosis or make an assessment. It's important. In fact, it's a bad doctor that will see a lab result and then treat. You still need to ask questions. You still need to interview the patient. We treat people, not lab results. Remember that those things are machine. There are human errors. That there are different things that can go wrong. So there's nothing that can replace that doctor-patient interaction. In fact, 80% of the time, a diagnosis is already made. We ask for investigations to corroborate what we're already suspecting or to rule out some other things. So next time you present in the hospital with a lab investigation or a radiological investigation or whatever investigation, and your doctor still wants to ask you some questions, please allow him or her to do his or her job, because that is very important. It is very important. The second side to it are some patients that do not want to do investigation. They do not want to do any investigation. They feel that they should just get treated. As I said earlier, after interviewing a patient and doing a physical examination, there are some things, there are some diagnoses, there are some conditions that can be similar that investigations can help to delineate. So when investigations are very important and they have their place in reaching an assessment or making a diagnosis, so far the doctor is able to explain to you the reason why he or she is requesting for the investigations. The other aspect to it is that you should communicate with your doctor. If you do not have the financial wherewithal to do all the investigations that you have been given, the doctor may be able to streamline those investigations or find alternative pathway to managing you if you reach a common ground. So communication is very key. If you do not have the means at that time to do such investigations, please communicate to your doctor, have an understanding, and then you can come to a conclusion. As regards treatment, I want to emphasize at this point, and that's the fourth point now, that giving injectables is not synonymous to better efficacy. I see people who have come to a clinic and say that doctor is a bad doctor because he doesn't write injections. She doesn't give injections. There's indications for giving a patient injections, and the fact that you were given oral medications doesn't mean it's inferior to an injectable. Another point of note in concluding this session is that we should get insured. Insurance is very key to having universal health coverage. Every human being, male, female, young, old, is entitled to equitable, quality care, and that can only be achieved through health insurance. You may say that I do not work in formal sector, so how do I get insured? There's the voluntary contribution social health insurance scheme, which is under the National Health Insurance Scheme, and there are some other private health insurance schemes springing up here and there. What does it do for you? It removes your financial burden and risk, and as a result removes the delay for primary and secondary delay in seeking health. So please get insured today. And on a final note, remember we're still battling with COVID-19. Please live and let live. Use your face mask. Wash your hands regularly. Avoid crowded places. And ensure that you use your hand sanitizers when you do not have access to washing of hands. Please stay safe. God bless you.